Okay, so here we are with practice case number 2. And practice case number 2 is actually just a continuation of practice case number 1. Just now we are treating the lower arch. Okay, so first step, turn on the upper arch. I like to tilt them all up like this. And I like to position my lower incisors relative to the upper incisors, and then the entire case is built around the position of those lower incisors. So first step is going to now be to click on Add Setup. We're going to select the lower jaw, click on OK. We're going to click on Staging Tool, and I'm going to go ahead and take the lower left central incisor there, move it over so it's aligned with the upper midline. Click on the lower right central incisor, unrotate it, and click it so it is aligned with the upper midline. So now we have the midlines aligned, okay? That's all we're going to worry about for right now. We're going to turn off the upper, and I'm going to go ahead and, since I have this view open here, I'm going to go ahead and do the tipping on that central incisor. Just make sure we're still generally have the midlines aligned. Same thing with the left incisor. So I want to get these two central incisors really where I want them to end up, because the entire case is going to be built around that foundation. Now I'm going to rotate around to the occlusal and even these two teeth up a little bit. And now we're going to work on the rest of the case, okay? So the way we're going to resolve this crowding and do the lower arch setup is we're going to build in a little bit of what we call a margin of safety, okay, to help reduce the chances of tooth collisions. The way we do that is we're going to just separate these teeth here a little bit, and we're going to just work our way back. So I'm going to start with the central incisor here. I'm going to move to the lateral incisor. I'm going to position that lateral incisor next to the central incisor where I want it to be, and rotate this tooth. And you can see this tooth needs quite a bit of torque as well. I'm going to move to the canine now, and I'm going to move this canine to where I'd like it to be. I'm going to distalize it just a little bit. And then now I'm going to take this entire segment here, because you can see there's just a slight amount of overlap there. I'm going to take this entire segment here, and I'm going to distalize this whole segment. Now I'm holding on the control key, and I'm left clicking with the mouse. That is allowing me to highlight all those teeth, and I'm going to distalize this whole segment here. Now, is this happening clinically? No. It's no different than placing an open coil spring right here, okay? If we have fixed appliances on this case, it's no different than placing an open coil spring there, okay? So what's going to happen clinically is that we're going to get, probably mostly some advancement of those anterior teeth, very little distalization of this posterior segment. So are you going to be throwing this case into a class 2? It's not going to happen. I've never seen it happen in my cases. If you're concerned about it, I monitor these things clinically. You can always back up the anchorage with some class 2 elastics just by cutting a small slit in the aligner and have the patient wear some class 2 elastics if you're concerned about it. But clinically, I just don't see that happening with my cases. So now we're going to move over to the left side and repeat the same process over here. I'm going to advance this tooth. You see, I probably could use a little bit of torque, and I'm just going to take this tooth and I'm going to move it over so that there is a nice little space there, okay? And then we're going to do the same thing here with the canine. I'm going to move this canine over. I'm going to advance it a little bit. And then I'm going to take this whole entire segment, and in the digital setup, we're going to distalize that. Oh, wrong way. And go ahead and be aggressive with it. I mean, it's okay to create spaces in this digital setup. All the spaces is going to do is reduce the chances of collisions, okay? And at the end, it's extremely easy to just make one or two more aligners to close the space, all right? The whole idea here with this is to get us in the ballpark where we can finish the case. Okay, so the whole idea of this first go through here is get us to a point where it's very easy for us to refine it with an additional scan, or to finish it without even taking another scan, but doing some very targeted tooth movement with a few more models or aligners. Okay, so now I'm going to wrap around to the facial here, look to see if there's any additional tips I need. So you can see this tooth here needs some tipping. And possibly some intrusion here. Okay, and then I'll look at this relative to the upper. Now again, in the setup, it looks like the patient is class 2, but remember what's going to happen is we're going to get some advancement of the anterior teeth, and we're not going to get distalization of the posterior segments. So when you get done, when the patient gets finished with wearing this series of aligners, you can always do refinement. So at that point, if you'd like to do some IPR here and retract those incisors, I would much rather do IPR when the teeth are aligned because I have very good access. So I'm not going to create any ledging or uneven edges. So I always like to align the teeth to ideal, and then reevaluate the overbite and overjet and decide if I need to do some IPR then. It's much easier to do it then when the teeth are aligned like this, and then just do a few aligners to retract and close the spaces from the IPR. I found it's much more consistent, and I get much better results. So anyway, now we're going to go ahead and click on OK. And the software is now going to morph the gingiva and then calculate all of the tooth distances that we just created. So again, depending on the speed of your computer, it may take 30 seconds to a minute or so. So now we're going to go ahead and if you like, you can close the upper jaw and focus on just the lower jaw by clicking this little X here. So you can close either one. And then I like to drag this over. You might have to click back to setup 0 and then to 1 to have the software highlight all the tooth displacements. So in this case here, it looks like our largest displacement is the 11.27 degrees of tipping, and that is on the lower central incisor. So I would, for this case here, use 12 intervals. I just don't like to torque or tip a tooth any faster than 1 degree per setup. So now I'm going to click on create interval, lower jaw, OK, and then we're going to go up to 12 and then click on OK. And then over here now you can see that the software is creating the intervals, and again, depending on the speed of your computer, it's going to depend on how long it takes, but it should take less than 5 minutes. Okay, so I'm going to go ahead and pause the recording and then come back when that's finished. Okay, so now when over here in the progress window, when it says create interval done, then you know that the software is finished creating all those intervals, and you can then now go through and click through those intervals. So you can see here's 1 through setup 12. Okay. Now I always like to, just a little clinical tip here, is that as my patient is progressing through the aligners, I always just like to have, when the patient is there for their checkup, and I see my patients roughly every 2 months, I give them roughly 4 aligners at a time. When they come in, I like to have the floss there at the chair and just run floss in between the contacts where I know I'm moving the teeth. If there's any contacts the floss binds, my assistants have a little IPR strip out, and so I would just do a little bit of IPR in between the teeth, anywhere that there's some binding, and then that really just ensures that you're reducing the collisions and also doing IPR, when and where it's needed, kind of on a sort of an on-demand basis. And I found that to really just help. It's a very quick and easy thing to do, and just allows the tooth movement to be much more efficient. Okay, so now we have all 12 of our setups done here. Then what I would do, the next step that I would do is I would go and look at and decide which teeth would I potentially place attachments on. Whenever I have large tipping or rotation, then those teeth I would definitely consider very seriously placing attachments on those teeth. And so we'll cover attachments in a different video. But at this point, that is how the lower arch would be treated. And I look forward to seeing you in the next video. Thank you.